Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Kingston. We'll hold these forums every Tuesday and Friday at 10:30 a.m. Watch in Kingston on Comcast Channel 15 and Verizon Channel 42, or watch online on our streaming channel by visiting pactv.org/live. To ask questions during this forum, email them to kingstoninfo@pactv.org. Again, that's kingstoninfo@pactv.org. For the forum replay schedule and additional Kingston meeting coverage, please visit pactv.org/Kingston. Today's participants include Josh Warren, who's the chair of the Board of Selectmen, Tom Calter, the town administrator, Adam Hatch, deputy fire chief, and Paula Rossi-Clapp, the director of the Elder Affairs for the town of Kingston. So without further ado, I will turn it over to you, Josh Warren.
Julie, thank you. And thank you to everybody at PACTV for continuing to support these COVID-19 updates, not just for Kingston, but for all the communities that you serve. Since Friday morning's televised update, a lot has changed in Kingston, Plymouth County, Massachusetts, America. All across the nation, we've seen a sharp increase in the number of confirmed positive cases of COVID-19. And just to give you a snapshot of what figures look like at the local level, as of yesterday afternoon at 4:00 p.m., the Massachusetts Department of Public Health had 5,752 confirmed positive cases in Massachusetts, 380 confirmed positive cases in Plymouth County, and we have 9 in Kingston. Sunday evening, President Trump addressed the nation and announced that Americans should continue to avoid gathering in groups of 10 or more for at least another month, possibly until June. This means to avoid things like going into the office, going out to bars, seeing friends, traveling, going out to restaurants, etc. And that was a pretty big reversal from previous statements made by the administration that the country would be back to some sense of normalcy by Easter. Now, I'm not saying this to frighten anyone, but I just want to make sure that we all know and understand the tremendous risks posed by this deadly virus. Given the ease at which this virus spreads, the actions that we take and the decisions that we make each day have a direct impact on our health, on the health of those living in our homes, and on the health of everybody living in Kingston. So by washing our hands, by avoiding close contact with individuals who are sick, by continuing to avoid crowds and keeping a distance of at least 6 feet from other people when we're out, and only going out for the essentials. By doing those things, you're not just protecting yourself and keeping yourself safe, but you're really keeping the entire community safe and healthy, especially those in the community who are most vulnerable. And with this epidemic, it's our seniors, it's individuals with underlying health conditions. And with that, I'll turn it over and start asking some questions of the other folks who've joined us today. And Tom, I know you've got to run to another meeting, so I'll start with you. Over the last several weeks, you've been heavily involved with the town's response to the COVID-19 pandemic. From where you're sitting, how is the town doing, given the tremendous uncertainty that confronts us each day?
Josh, I got to tell you, I spent 35 years in the emergency response business, where every day was a form of crisis. And as compared to that, town has emerged as a leader in how to respond to crises like this, and in due in very large part to your leadership. And I want to thank you for that. I mean, I haven't seen you physically in a month, but I've never worked closer with anybody than I have with you in the last month. Your leadership from afar is very striking and appreciated. You know, our town is like every town in Plymouth County, in the state, in the country, hugely impacted by the pandemic. But we haven't missed a stroke. The wheels of government continue to turn. There's only one other person today in town hall with me, but we just finished a 90-minute conference call with every department head. And every department has got a plan of the day and a plan of the week. And every department head has got a plan for speaking to their staff and making sure they have the same. 2 weeks ago, we got set up electronically in anticipation of a time when we couldn't work together. And our staff is communicating all day, every day, as effectively remotely as they would be if they were right here. So in answer to your question, I couldn't be more pleased with the way the town is operating. And as you know, the board gave me three major priorities a month ago: keep our employees safe, keep our employees productive, and keep our employees informed. And that's what we do every single day. And I'm pleased to tell you, as the chairman of the board, that our employees, whether it be in the COA, whether it be in police, fire, facility, across the board, library, recreation, they're all working. They're all working very hard. Today, following this meeting, we're going to have a sit down with the department head for streets, trees, and parks. Those folks have been home in quarantine because we didn't want them out in the public. But we now have a plan for them that'll put them back to work, and then we'll be 100% fully engaged. So again, in response to your question, compared to what I've been involved in my life in the hazardous waste business, I couldn't be more pleased or even more proud of the people of this town right now, particularly the employees that are working for the town of Kingston.
And in those last few weeks, as you've seen, everybody sort of pick up their daily work life and either bring it home with them or modify, where, when, and how they're doing it. What surprised you most? I mean, what's been the biggest surprise to you?
I guess my biggest surprise, even this morning, is the morale and the motivation of employees is at an all-time high. I didn't know if everyone would respond the way they are. People are going above and beyond to communicate with their colleagues, to communicate with their staff, to stay on course. If we were to come out of this pandemic a month from now, I can tell you that we will not be behind on anything, from minutes to a meeting to permit applications. We've got two public hearings this week and two next week, and we're doing them remotely very effectively. The technology's in place. The applicants are on board. We're planning well ahead of that evening. And so what has surprised me the most is how seamless this transition has been. You know, I'm not a young guy. I've been around a while. I'm used to doing everything in person. So I'm a bit surprised that technology has allowed us not miss a beat. And I encourage the people in Kingston, continue to call department heads. Their phones are all forwarded to their emails and to their cell phones. We're committed to not missing a beat. And I'm just so delighted that the employees are taking that so seriously.
Thank you. And that sort of segues into my next question. So this will eventually pass. We don't know how long it's going to take. It could be weeks. It could be months. Nobody knows. But what are we doing? What are you doing to make sure that when this does pass, we're not only able to pick up the pieces, but we can continue to charge forward?
Well, the most important thing is to stay current. Stay current in everything. This isn't a time to take a deep breath. It's not a time to, put things off till tomorrow. In all of our busy lives, there are things we put off to a later date, and somehow we don't get to them. This is a time where it's a slower pace, but it's a more deliberate pace. So we can get to projects that we weren't able to get to. We can develop plans that we weren't able to get to. It's important for everyone to understand throughout the town and throughout the townhouse and with all employees. There are things we can control and there are things we can't control. We can't control the timing of the pandemic. We can't control reduced revenue. We do not have revenue coming into the town as of right now. We're not collecting receipts because the receipts aren't there to collect. All we can control is our own behavior and our own productivity. So I'm very comfortable that when this pandemic is over, we will be current, we'll be up to date, we won't be behind on anything, and we will manage through the financial impact of this as we approach the end of June, the beginning of July. We won't be behind on anything, and that's because we've got a plan to stay current, to be productive, and to remain focused every day. And that's why we talk with every staff on the phone at 9 a.m. every morning, is to go through POD, plan of the day. If we take care of every day, the 2 months will take care of themselves.
Great. Thank you, Tom.
Thank you,
Now,
Josh.
I appreciate you joining us this morning, and I'm sure we'll have you on again for a future COVID-19 update.
Now you can interview the real superstars. Thank you, Josh.
Thank you, Tom. I just want to mention too, before we move on to Paula Rossi-Clapp, Director of Elder Affairs, every day, typically around supper time, the website www.kingstonmass.org is updated with the increased numbers from Mass Department of Public Health, or the numbers from Mass Department of Public Health that are released at 4 p.m. If you actually click on the COVID-19 logo right on the homepage, it'll bring you to a dedicated page where you can get information from the CDC, Mass Department of Public Health. There's contact information for a number of departments that residents may be looking to at this time for support. And then there's also external resources like Massachusetts 211. We've recently added links for anybody who may be in need of advice or support dealing with the stress that they may be feeling at times like this. So we're really trying to make that page, as Tom said, as current and as relevant as possible throughout this. And I'd certainly encourage all residents who have access to a computer and the internet to stop by there a few times each week. Again, it's updated daily. And I just want to thank both Jana and Diane in the clerk's office, because every evening, typically around 5 or 6 o'clock, they're online and they're making those updates so that residents have accurate and current information. So Paula, I'm going to turn it over to you. You've been kind enough to join us on the last few COVID-19 updates. And just as a general check-in, how are things going this week at the COA?
We're doing well over here, Josh. Thank you. We're still making changes as it evolves, and we are doing some things to help the safety of our staff as well as the community that we go out to take care of. So the staff is doing well. Some of us are working remotely, some of us are in-house, but we're all still connected and still have energy and ready to get out there and help anybody that needs us.
Thanks. And I understand yesterday you enacted further precautions for the transportation services that the COA provides. Can you just tell us a little bit about those?
Yes. So just for the extra safety for our drivers and the passengers that we transport, we have changed to only transporting one passenger at a time. We can still do multiple trips, or many trips throughout the day, to grocery stores, to pick up prescriptions, to go to medical appointments. But we are only having one driver with one passenger. Then the van gets desanitized, and we'll pick up the next person to go to the next trip. And the drivers have, they were just recently provided by the Board of Health extra masks. So the drivers have masks, they have gloves, and they desanitize the vans after every run. Oh,
thank you.
And I actually did want to
so
activate one other change we did make as far as the interaction is we decrease the number of times we're going out to do the Meals on Wheels to Mondays, Wednesdays, and Fridays. We normally will deliver Monday through Friday, but we're doubling up the number of meals that we're delivering so that the drivers are only going out Mondays, Wednesdays, and Fridays for the Meals on Wheels program.
Great. And if anybody watching is interested in enrolling in that program, who should they get in touch with?
Yes, please reach out to Old Colony Elder Services. They're located in Brockton and Plymouth. They have 2 phone numbers, and they can set you up even temporarily on this Meals on Wheels program. It's free to seniors, and it's just a way to help stock your pantry and have those emergency meals. You can also call the center if you want to know more information on the program.
Now, Paula, with the president's statement on Sunday, it's now clear to many in our community that the COVID-19 pandemic could go on for longer than some anticipated. What can seniors do to prepare for what could be weeks or possibly months of this pandemic?
Oh, sure, Josh. So we did talk a little bit about the different ideas and definitely connecting with Old Colony Elder Services to just put this Meals on Wheels in place, even if it's just temporary. Also, you and I spoke about if they're worried about caregiver support. There are backups for people that, if you're worried, if you need more caregiver support as time goes on, you can call our office, talk to Darlene in outreach. You can call Old Colony Elder Services. You can get backup systems in place for your caregiver support. You can call and get your prescriptions in quantities of anything from 30 to 90 days. There is, you can call your doctor and we can help you get over to your pharmacy, or you can call and get on the Express Scripts is another program that will deliver to your house. Again, call outreach, call our center, and Darlene can help you with other resources that way so that you can continue to stay in place. And one last thing, if you're having difficulty with your pet food or taking care of your pets, please reach out to Joanna at the Animal Control Officer, and she will help you with food supplies.
Thank you. Now, this is sort of what I think you were alluding to. A lot of us in Kingston, now may have a friend or a relative, or even, once removed, a contact who has tested positive for COVID-19, and those individuals are either seeking treatment or are under self-quarantine. So there may be, throughout the course of this, a lapse in a caregiver's ability to deliver food, or a government entity's ability to continue to deliver meals as they currently are. Is there any harm in just reaching out to the COA now and making yourself known and talking about the services that you may qualify for? So if anything changes, given the uncertainty, you're right there, you're in line, and you're ready to start receiving those services.
Yes, you actually said that very well. That's it in a nutshell. Just reach out to us for the just in case we need it, or you need it, and everything is confidential. And we will just keep you on our radar and able to check in with you more often. And you just know that we're at the ready for your questions that you've already given us, and we're ready for the answers for you.
And would you encourage seniors to have a few days or a week's supply of non-perishable foods in their home? I mean, is there a certain prescription that you'd give in terms of if there was ever a shelter-in-place order, or if there was again a lapse in a caregiver's ability to come out and do the things that they may currently be doing? Would you advise seniors to start to think about what those few days or a week's worth of food would be?
Yes, and that is exactly what the Old Colony Elder Services Meals on Wheels program is all about. They provide you with enough meals to get you through an entire week, plus they give you an extra 3 days of dry meals as well. And I can't encourage that program enough, and as well as contacting us, because we do have other resources, and we have the ability to get pantry supplies for you, and we can supply you with your necessary dry goods to store as well. But reach out to us, and we can help you.
Great. Paula, I appreciate it. I've got one more question for you. Sorry, I'm just getting a little bit of feedback. Those of us with senior parents or seniors in our lives, what can we do to support them throughout this?
So I think that's why it's been an easier transition for the COA. I think that the Kingston population is very well networked with their seniors, calling them on a regular basis. The neighbors are calling them and doing wellness checks, not just the COA, but reminding people just to reach out and make that friendly phone call every day or every other day. Contact us. We're also doing the friendly phone calls just to check in. And what you might hear from them one day is they're doing fine, but then a day or two, they're starting to get a little bit down or a little bit worried about something that maybe they didn't talk about a few days prior. So just that constant contact is very important right now, that we all know, for everyone, not just seniors, but seniors are most vulnerable at this stage.
Well, Paula, thank you. If you don't mind sticking around, I know after we hear from Adam, we may have some questions that Julie's been receiving. So
Sure,
some may be for you. So if you don't mind sticking around, that'd be great.
sure.
So Adam, at this point, I think we've all seen or heard what the symptoms of COVID-19 are: fever, cough, shortness of breath. If somebody's symptomatic, what should they do?
Josh, what we've been recommending from the start is to call your primary care physician. They'll be able to possibly give you a screening over the phone based on the symptoms you're describing, and then direct you to either be tested or to quarantine.
And if someone's looking for testing information, do they call 911?
No, we don't advocate for that. As always, 911 is specifically for emergencies. Again, if they have any questions as to testing facilities, locations, we ask that they call their primary care physician, and they should be able to direct them to where they need to go.
Great. And you, I think, started to answer my next question, which is at what point during this would somebody call 911?
Well, as always, we don't want anybody to wait. If somebody's concerned to the point that they feel they need to call 911, then please call. But chest pain, shortness of breath, anything severe like that. If you have a fever, we'd want you to call your doctor first, and then they can advise whether you should be seen or tested. But obviously, any sort of a life-threatening respiratory, chest pain, anything like that, we want to hear from the residents so we can interact with them and intervene.
Thank you. So how is the Kingston Fire Department currently handling medical transportation for COVID-19 related calls? So if you do get a call, what's the process like right now for you guys?
So, Josh, what we're doing is we're trying to limit the exposure of the members to the residents and the residents to the members. So we've come up with a modified response plan where we tried to limit the amount of people that are coming into contact with the members that are interacting with the patient are wearing their full PPE, masks, gloves, gowns, also masking the patient as well. After the transport, the ambulance will return to the station and decontaminate itself. Will be decontaminated by the members before it goes back into service for a subsequent call. We have ultraviolet lights in the trucks that we use. We have the industrial fogging machine you may have seen that we sanitize the vehicles with. We sanitize the station several times a day, and the members are taking extra precautions to make sure that they're decontaminated in between calls.
Great. And you mentioned that EMS workers, firefighters are wearing PPE when they respond to those calls. I think it's probably a good time to just mention as well to residents that there is still a shortage on those items: N95 masks, the Tyvek suits, medical gloves. And those are things that you guys are still accepting in donations should somebody stumble upon some at home?
Absolutely. Absolutely. The residents have really stepped up for us. We've had donations of Tyvek suits, gloves, and N95 masks that they happen to have in their homes. Businesses have donated what they had, hand sanitizer, cleaning supplies. So we're so happy that the residents they're stepping up and helping us to help them. But we certainly welcome any sort of donation to that effect. They can bring it to the fire station on Route 27, and we have a box set up out front that they can place those items in.
Great, thank you. And it's great to hear that residents are stepping it up with those donations. First responders and healthcare workers are on the front lines of the pandemic, and the exposure for all of you to individuals with COVID-19 is extremely high. Are you monitoring the health of those working in the station?
Yes, we are. We're closely monitoring the health of the workers, the members, and ourselves. And we do have, there is a facility available to us out in the western part of the state that if we feel we need to be tested after an exposure, that can be done.
And Adam, one more for you before we turn it over to Julie for questions. None of us know what the next few weeks have in store, but do you have any predictions on where we're headed in terms of call volume at the station or strains on first responders and our hospital system?
I can only imagine that just like it's been countrywide, that they will increase. I can't put a number on it or a definite trend, but we can only assume that it's going to increase, and that in effect is going to wear on the first responders as well.
Well, I certainly appreciate everything that you're doing and everybody at the firehouse is doing. And if you as well don't mind sticking around just in case any of the questions are directed to you, that'd be great.
Absolutely.
Julie?
Hi, thank you very much, Josh. There's a couple of things that have come up. First of all, there are some residents who would love to hear from anyone from the school department. So if you could get maybe somebody to be on Friday, that would be great. Another thing is the whole issue of mental health. People that right now might have anxiety or they might have any kind of mental health condition that is obviously made worse by this situation that we're in. Can you talk about telehealth and how that is covered by most health plans that people are on, and that includes the mental health end of it? I don't know who of you could answer that best.
Telehealth certainly is not my area of expertise, but I can say that having spent now an inordinate amount of time over the last several weeks on the mass.gov website and the Center for Disease Control's website, there is no shortage of resources available there for residents. We've linked to those pages on our website. And Julie, can you pull up our website again on screen? And if we go over to the COVID-19 specific page on the website, towards the bottom, there's a couple of resources that I'd like to direct residents to who like many of us are starting to feel the stress and anxiety that's resulted from this. So if you go to that page at the very bottom, and I'm just going to pull it up on mine so that I can view it as well. At the very bottom, there's a link for Massachusetts 211. That's a call center that's open 24/7. They also have a live chat option on their website. Anybody from a landline or a digital device can call 211. And they have a call center that's staffed, again, 24/7. There's a COVID-19 related or COVID-19 specific call center that will answer any questions directly related to the pandemic. But if you call with any questions, concerns, if you call looking for resources for anything related to mental health, they can assist you with that. And right below that as well, there is a small blurb with a link, and it says, taking care of your emotional health and well-being during this time is important. Click here for tips from the Massachusetts Department of Public Health for resources for reducing stress and healthy coping, combating isolation and loneliness, activities for children, mental health crisis support, and more. And again, that's a link to DPH's website where they have a much larger staff. They have many more resources than we do to provide advice and support during times like this. Regarding telehealth, I can certainly see if by Friday we can have somebody lined up to come on that can speak specifically to that. And I'll continue to work with the schools to see if we can get a representative on. I did reach out to them, and as I'm sure everyone can imagine, they've been very busy figuring out, just as all of us have at the townhouse, how do you continue to operate? How do you continue to make meals available to students who qualify for free or reduced lunches? How do you support staff through times like this? So I know they're as busy as all of us, and I'll continue to work with them and see if we can have somebody come on to answer questions specific to our school system.
Great, that's excellent. Thank you so much. The one other thing we have gotten questions from other towns as well as yours is about if people had real estate transactions that had been planned, they're passing on a house, they have to move. Are there any of those inspection services still open? Like you have to get your fire extinguishers tested if you're going to move into a new house, that type of thing?
So, Julie, this is exactly why I asked Adam to stick around. A couple weeks ago, we were in a position where we couldn't support those buyers and sellers in Kingston. And thanks to the quick work of Deputy Fire Chief Adam Hatch and Fire Chief Mark Douglas, things look very different. So I'll let Adam answer that question.
Yeah, Julie. So last week, or 2 weeks ago, rather, we developed a virtual platform to continue just this. Again, trying to keep business moving to the best of our ability. So homeowners that are selling their home, real estate agents, can do it virtually, email the results to me. We have a checklist on how we want it done. And once I review it, I get in touch with them, tell them whether it's passed or not, if not, what we would correct anything. And then what we do is we fill out the appropriate paperwork and leave it in a on a table out inside the foyer of the fire station. They can come pick it up and drop off the associated fee as well as their signed paperwork that they have to provide to us.
Thank you. That's excellent information. And on another side of that, which really isn't to do with fire, but more probably for police or courts, are the courts still open? If someone has a restraining order or if something needs to be filed with a court, how is that being handled at this point?
I can't speak to what the police are doing. I can surmise that they're doing something similar. And they also are having a lot of, I believe, foot traffic coming into the station to do a lot of that stuff in person, so to speak. But to the specifics of it, I'm not really sure. I can only imagine they've switched to some sort of a virtual platform for certain things.
And just on that as well, I know just through conversations with Chief Splain during our emergency management team calls, services and I guess day-to-day operations at the county level have shifted somewhat. I know that just in conversations with him, police officers who otherwise may be going to the courthouse are now freed up to be here in Kingston. Similarly, with the schools being closed, our school resource officer is now available to do some work in the department in town. So as we're sort of bracing for, what could hit our departments in terms of employees contracting COVID-19, as it relates to that question, Julie, I know that our officer who would otherwise be at the courthouse has been freed up, and that has put us in somewhat of a better position in terms of staffing locally, again, with the school resource officer being freed up as well.
Okay, and I have one more question about food services. So people, there's a lot of restaurants that are delivering. There's a lot of restaurants where you can go to have pickup. Have there been any problems with that? Is that running well? Is there any advice to people in town? And where can they go to get an updated list of exactly the restaurants that are participating in this?
I don't think there's any consolidated list. If you go on Facebook, residents have been quite vocal in their support of restaurants that have been able to weather what's going on and change how they operate. Obviously, with the inability to serve patrons in the building, they've shifted to curbside pickup or delivery only. Things of that nature. I don't think that there is a consolidated list. I haven't heard any issues in terms of businesses, running into any major problems. But I can say, just from what I've seen online, residents that have been doing takeout or have been getting delivery have certainly appreciated that. And I think, for some, it may bring a sense of comfort. It's for some people, going out to eat is something that we enjoy and part of our daily lives, and to continue to have those things when everything else is in turmoil, I'm sure is comforting.
Okay, thank you. Again, not only during these forums, but at any time you have any questions that you want passed on to the groups that will be on here in the future, every Tuesday and Friday, please do email us at kingstoninfo@pac-tv.org. We will answer your questions, or we'll get them to the appropriate guests that'll be on these forums to answer. That's all the questions I had for right now. Oh, except, is the transfer station open? That just came in.
The transfer station is open. I went down there myself for the first time this weekend, and I had all of my recyclable bottles and cans. And I noticed that the shed where those would usually be placed was boarded up. So I'm going to work with Paul Basler just to see if that's what we're looking at for the foreseeable future. And once I have an answer there on whether or not they'll be accepting bottles and cans and things like that, I will include that in today's update to residents. Again, those updates go on the town website, usually around supper time. And if you go to www.kingstonmass.org and you click on the COVID-19 banner, it'll direct you to the page specific to the pandemic. And there are daily updates that are provided. And the transfer station is open. And you know, my own curiosity, I'm going to find out if they'll be accepting bottles and cans throughout this. And I'll include my answer in today's letter.
Great. That's all I had for right now. If you want to just wrap up with your group, and then I'll do a final shout out to everybody.
Sure. Julie, thank you again for supporting these updates. And thank you for all the recommendations on what other towns are doing and what we can do to provide additional information to residents. Since last Friday's update, I've actually reached out to a local leader at a church in town who will be joining us on Friday, just talking about our own personal wellness and how we can care for those in our house and those in our community at times like this. And I think that'll be a nice way to end Friday's segment and enter the weekend. This is a difficult time for us. It's a difficult time for everyone. Our loved ones, our neighbors, and all those in our community and as a town. It's the time that we have to come together and look out for one another. So I thank you all again for watching, and I hope you'll join us again on Friday so we can share anything that's transpired between today and then.
Great. Thank you so much. And just to let everyone know that aside from these forums that are done for Kingston every Tuesday and Friday at 10:30, we also have a daily forum done for the town of Plymouth, but it also goes beyond Plymouth. It's a lot of regional information if anyone ever wants to tune in every day at noon, and it's Monday through Saturday at noon. There is a Plymouth forum, which again has a lot of information that, yes, is specific to Plymouth, but a lot that's specific to the whole region. So please feel free to join us then too. So for right now, we're going to sign off until Friday. I'm Julie Thompson from PACTV. We ask you to please follow all the instructions, social distance, stay positive, be kind, and we will see you on Friday. Thank you.